Sweet pea. Hi, honey. Okay.
6-month-old Shira Fisher struggles for every breath at Victoria General Hospital's Pediatric Intensive Care Unit. Shira was diagnosed with SMA, or Spinal Muscular Atrophy, 2 months ago. It's a terminal illness that robs its victims of muscle activity, and SMA children rarely live beyond their toddler years.
Very hard for her to breathe. She often gets clots of mucus and things in her throat and in her chest that she can't get rid of by herself.
The biggest threat to SMA babies are colds and flus. Shira developed a virus a week ago.
Yeah, she's fighting for her life every day. She's attached to all kinds of equipment. If she wasn't on this oxygen with her BiPAP, she would die right now.
1 in 40 people carry the SMA gene. The Fishers suggest all potential parents get a blood test to determine if they're carriers. 2 carriers have a 25% chance of producing an SMA baby. The Fishers are quickly becoming SMA experts, but say BC's medical community has been ill-prepared to respond to Shira's illness.
If they would have given her a vaccination for it right when she was diagnosed with SMA and they knew she was compromised, then there would have been a 70% chance that she would not get it.
3 weeks ago, when the Fishers first went public with their daughter's story, they feared without proper medical aids like a cough assist, Shira's already short life would be reduced further still. And their worst fears have materialized much sooner than anyone expected.
Right now, if we took this off, she would die.
As baby Shira fights off the virus, her parents have great praise for the nursing staff at the ICU. And they hope by going public they'll help other people who face a terminal diagnosis for their child won't also have to fight the system.
Not only the next SMA parent, but the next parent who has a child that has some kind of disorder or disease that doesn't fit into the system, that may be somewhat rare, or that they have protocol that is not effective or outdated, and people have to be willing to research and look and set up things so that children have support instead of no support.
Maxine Fisher is staying at VGH around the clock, hoping that Shira survives the virus and can be weaned off the air and oxygen that's being pumped into her lungs, so that the baby can one day go home.
Would face an untimely death. He felt this wasn't an urgent call.